Communication. Producing and receiving messages. Communication is the main human manner to develop social and relationship functions. Communication doesn't only occur by means of spoken language, but it is intrinsically enriched by a number of signals, such as facial expressions, posture, eye and body movements. During a conversation with another person, everyone has experienced affective feelings, mindful listening, inattention behavior. All these signals integrate the meaning of what we are going to transmit, and at the same time they constitute consistent feedback coming from others. Sometimes communication takes place in a non-verbal way. A visual signal, a handshake, a pat could be meaningful ways to communicate among two people. Communication can also happen via media, by means of writing, phone, short messages, email. In this case, the means influences the communication style, causing lack of feedback and other non-verbal ways of communication. With respect to direct interaction, communication via media is less effective and more ambiguous. In this didactic module, we will focus on interpersonal direct communication to understand the two agents interacting in the same place at the same time. Sensory and motor limitations may alter the possibility of expression of the person you are caring for. Although in a different way than usual, effective interpersonal communication methods can be developed by the patient to express their thoughts or their mood. Very often, the person you want to communicate with is already using his or her own communication methods, for example with their relatives, and so it is advisable to try to start from these modalities to develop the use of specific strategies and to apply communication aids. There are various types of communication aids which can be customized to be more functional on the basis of personal needs. The choice of these systems depends not only on their technical characteristics, but primarily on the adopted communication strategy they are supporting. Very often, the person you are caring for knows what he really wants, even if he or she does not have the chance to express it well. Listening and trying to understand is the first step in establishing an optimal relationship. We must treat the person with communication difficulties with the same respect owed to all others. The fact that a person communicates with difficulty is often interpreted as a cognitive problem. This is not always the case. The loss of communication skills does not mean a reduction of understanding.